sure to admit you. So thank you everybody for coming and joining our webinar today. This is obviously all about careers insights into medicine. And it's really great to have you all. My name's Emma. I'm representative of Medic Mind and Study Mind today. And we've also got our expert here with us who will be speaking with us shortly. So Hamza, if you wouldn't mind just popping over to the next slide. Um, if anyone can't see the screen or anything, please let us know. And also the questions, the chat is going to be open the whole way through this. We will have a question and answer session at the end as well. So if you want to put anything in there, Hams will either be able to answer it going along, or we'll answer it at the end as well. There is quite a lot of content to go through today, so we'll try and move on as quickly as possible. So first of all, we just want to say a really big thanks to the University of Hertfordshire for sponsoring this webinar today. The University of Hertfordshire is actually a brand new medical school opening up for 2026. It is currently only open to international applicants, but they're a fantastic medical school who are moving forward. And if you are an international applicant, their application cycle is still open. So please feel free to contact them, and we can also put you in contact if you want to contact us directly. So yeah, I will now hand over to Hamza for some careers insights into medicine. Thank you so much.
Hello, everyone. Can everyone hear me? My name is Hamza. I'm a final year medical student at the University of Glasgow. So I'm going to talk to you about kind of what it takes to get into medical school. I'm going to talk to you about what you kind of need to be thinking about. So I'm assuming all of you guys are I'm pitching this to a early year 12 kind of level. So people who are kind of looking to apply possibly this year, and talking about what medicine is like as a career from the inside, what it's like to be in a hospital, what a day-to-day life looks like at medical school, plus a day-to-day of actually working as a doctor. Because a lot of what I do is kind of on the wards now. So I'm seeing doctors and kind of acting in that role quite a bit. So we're going to talk about kind of things to expect over the next years, kind of for you guys. And I'm happy to answer any questions about what it's like to be a medical student as well. Right. So yeah, as I said, I'm going to be focusing on admissions test prep, work experience. So something that you guys will be thinking about now, from this point onwards, what a day in the life of medical student and the day in the life of a doctor looks like. And then we'll also talk about the summer camp and looking at like work experience and getting access to work experience. So the first thing you guys will be thinking about now, probably at your stage, is the UCAT, which is probably your next big thing to come to come that's going to come for you guys soon. It's a computer-based admissions test. The idea of the UCAT is essentially all of you guys are going to be probably when you're applying to medical school, you're all A and A star grade students. You're all going to be the top tier students within a year group. And so there isn't really a differentiator of loads of people who are all of very similar abilities to a very competitive degree. I mean, medicine has about a 9% admissions rate on average. UK-wise, not to worry you. But they want to find a way to differentiate candidates who are all very well academically suited for the degree. And so the UCAT is the aim to do that. It's a computer-based test. It's mainly used by the UK, but it's also used in Australia. It's also used by dental schools, and it tests mental abilities and behaviors that are being identified as important for healthcare professionals. Universities use it to varying degrees. So some universities will look at it almost exclusively and use that as the entirety of the basis of who they want to invite to interview. But some medical schools will use it less, and some will use it in conjunction with your academic scores to create a total and more holistic approach to how they want to look at you, and then decide who they want to apply to interviews. Four main sections. So verbal reasoning is the ability to critically evaluate information presented in large written passages. Decision making is your ability to make sound and logical judgments based on complex information. Quantitative reasoning is your ability to use numerical skills and numerical data to interpret information. And then the situational judgment test is real world medical ethics scenarios, but they're not really ethical. They're more situations that you might come across on a ward and how you would respond in line with GMC principles. So why is the UCAT important? First of all, it's a standardized test, so the aim is to take into account skills that you're not going to have practiced a lot during your A levels. But the big thing is it helps universities differentiate the candidates who have similar scores at school, which means prepping for the UCAT is very important alongside making sure you're meeting those basic requirements to be able to get an offer for medical school in your A levels, which I'm sure you'll all be doing. You'll all be thinking about getting those A's and A stars. But actually spending time focusing on the UCAT and learning those tips and tricks to help you get a higher score on the UCAT, because that's the main differentiator between all of you students. So actually, there are very few students that are looking at candidates between an A and an A star. As long as you're meeting the 3A requirement that most medical schools will blanket place on entry, some medical schools are A B now. But as long as you're meeting that basic requirement, there's no real differentiation between an A star, two A's, and a triple A candidate. But the UCAT is a differentiator, which means that a higher UCAT score in that situation will be more likely to get you a better outcome. So, big things for the UCAT. Remember to start revising early. Start revising as early as you possibly can. Practicing under the time conditions is always really important. Use the computer for your revision. So don't. I know a lot of people when I was applying for medical school back in 2019, very old. But when I was applying for medical school, there used to be a book that everyone used to like pass around. And you'd get it like as a hand-me-down from someone else who had done the UCAT the year before, and it was like a book of UCAT questions. We were told in back in then not to use that. It was basically recommended. And now, as the UK has become fully online, and there are so many good online resources for questions, really using any in physical textbooks or physical books is probably not very useful. You want to get used to doing it on the computer. You want to get used to seeing the questions as they would be presented on the interface that you would be expecting. And that's probably the most important thing. Then the other two things are more for test day, but remembering not to practice the section you find easiest, but find practicing the sections you find most difficult, because the marginal gains you get by improving very slightly on the section you find most difficult, um, is probably more significant than the gains that you will by repetitively practicing the section you find the easiest. You're not going to get as much out of it. The difference between a 99% and 100% isn't as big as the difference between a 69% and a 70% on a section in terms of your overall score on that section. And so actually practicing that section you find most difficult will help you improve your score more. Okay, so you've done your UCAT and you've been invited to interview. So what are you expecting on interview day itself? So usually now, most of your interviews in the UK are multiple mini interviews, which is kind of like circuit training, is the best way to think about it. It's where you have lots of different stations where they're assessing very different things, and you kind of just move around the different circuits, and you kind of get asked questions around a specific thing over a very short period of time. So, unlike a panel interview, which you might expect at somewhere like Oxford or Cambridge, if you guys are looking to apply to there, Glasgow, where I go, it's a panel interview. And a panel interview is maybe two or three people, and you spend maybe 20, 25 minutes having a chat with them where they'll ask you loads of questions around a specific issue. A multiple mini interview, you're only going to be asked very short questions, normally even less than 5 to 10 minutes. So normally in that lower end of that 5 to 10 minutes, you might be expecting 5 minute stations. Some interviews I did at Exeter will be a 3 minute interview, for example. So these are really short interviews that you're expecting, where you're going to be discussing a topic. The aim again of an MMI is to assess the things that your A levels can't tell the interviewers, or the A levels can't tell your medical schools. And that's your soft skills. So communication, are you able to talk to people? Are you able to empathize with them? Are you able to think critically? Are you a memorizer, or are you able to really process a problem and think about it in a logical way? Are you able to deal with ethical issues and see both sides of an ethics issue? Are you able to come to rational conclusions? Are you able to interpret data? Again, it's used to differentiate between candidates with similar academic achievements. But I would argue, comparative to the UCAT, where the UCAT is a key differentiator between candidates of similar academic achievements. The MMI is more of a gauge of whether you meet the suitability and the values of what they would expect a future doctor to have. Remember that you don't, unlike maybe if you're applying for maybe an accountancy job where you'll do your degree and then you'll come out and you'll be interviewed by the companies you want to work for, there isn't an interview before you start FY1. So this is the last chance for universities to decide whether you've got the values required or the values that are in line with the values that they're hoping for a future medical professional in the UK. And so that's why interviews are so important because they are basically the last line of kind of almost defense against making sure that the right candidates are getting into medical school. And so practicing interviews are really important and making sure you have an understanding of what the values that they are looking for that will help you gauge what they're wanting out of you as a candidate. So the MMI format, it's essentially speed dating or the circuit training of dealing with kind of medical school or dealing with a medical school. It's usually about 6 to 10 stations, about 5 to 10 minutes each, spending maybe 1 to 2 minutes reading a scenario and then entering a room and being asked to perform a specific task. The whole interview will tend to last 60 to 90 minutes. It's not very long. It's a very quick snapshot. You really have a very short amount of time to set an impression. And that's kind of quite crucial to be able to do. So what sort of things would you be expecting to see in an MMI? This is quite an important question. Ooh, so hopefully this loads. Click to the next screen. Ah, and back, and back. Okay, so most stations. So common stations are common. Ethical scenarios are pretty much everywhere. So you'll be asked a ethical dilemma. Usually it's a clinically ethical dilemma. It's a scenario now. So they might not ask you about something specific, but they might ask you about like a friend asks you to lie for them, or what would you do if you saw a doctor come into a ward drunk? Those are the kind of important things to see whether you've got the integrity required. Teamwork and collaboration. There are some teamwork collaboration stations across the UK, not very commonly, to be fair. And then your standard interview questions, they want to see whether you're motivated, reflexive, whether you're able to discuss your skills. They want to see whether you're able to discuss your identity and what has driven you to this position um, to kind of deal with medical students, to deal with the demands of being a medical student. Data interpretation, again, critical thinking. But essentially, every station that they're putting in, they're trying to gauge a specific quality or characteristic that will help them gauge the best medical students possible. So they're not putting all of these stations in willy-nilly. They're doing them for a specific reason to gauge a specific characteristic that they want to see whether you're able to show them. Next, why is the MMI important? So again, it's an assessment of soft skills. Um, Generally, MMI scores tend to correlate better with clinical performance than actually than most of your academic criteria. So there's really good research that we've actually did at Glasgow, one of the papers on this, which we looked into MMI scores and OSCE outcomes in final year. So we followed people who'd done MMIs kind of in MMIs and panel interviews in their first year of medical school, and we looked at them and we looked at what their OSCE outcomes were in fifth year. So the OSCEs are a type of assessment in medical school where you're aimed to talk about and you're aimed to kind of deal with clinical scenarios, so actual medical things that are going on, and you're aimed to manage them. That's what they're testing. And actually, they did correlate quite heavily. So people who tended to do better at interview tended to do better on clinical performance testing, even 5 years, 6 years down the line. So interviews are really important, and getting ready for your interviews are really important. Making sure you're preparing for your interviews well is really important because you can get a good understanding of what skills are required to be successful in a career in medicine. Um, and then how to prep for an interview. So four pillars as your compass for ethical questions. One of the big things is that often people can gauge whether a candidate is appropriate or suitable within the first 1 minute. But making sure that you're able to kind of make a good first impressions, thinking out loud, being clear with your communication, being direct. Um, you want to show that you're personable. You want to show that you're able to communicate well with the interviewer. You want to show that you're professional. So although they're saying not professional but you do want to still be professional. You want to show that you would be successful in a professional setting, um, like a doctor would be in the end. But probably right now, what you're thinking about the most is if you're kind of currently in early February of year 12, you're probably thinking right now, first of all, I want to get my AS exams done, which probably are quite important. And secondly, or your year 12 mocks. And secondly, you want to do your work experience. Um, so why do they ask you to do work experience? Does anyone have any thoughts of why they would ask you to do work experience? I'll monitor the chat for a moment here. Any thoughts? I'll come back to answering the questions as well. Any thoughts of why they want to do work experience, or why medical schools will ask you to do work experience? So that you're ready for the career? Yeah. Shows that you're working with people. Yeah. So see how you're working with people is probably more your volunteering. So I normally talk about two pillars that every medical applicant needs to be doing from now. I would say from your stage right now till your applications are over, is volunteering and work experience. And they're slightly different. So volunteering is some sort of charitable, community-based project that you want to do. Doesn't necessarily have to be clinical. Lots of people get bogged down of trying to find care homes to volunteer at, but even going to a charity shop, and this is where you build your soft skills. It's where you build your education. It's where you build your empathy. It's where you build your teamwork through your volunteering. But more crucially than volunteering is your work experience. There are two things I always talk about when people talk about why they want to do medicine. So I help mark a lot of interviews, um, both for Medic Mind and kind of I've helped at Glasgow as well. And the two things I've noticed in my time of marking interviews is that you get loads of candidates who, when they talk about why they want to study medicine, they're really, really motivated, but they don't really understand what medicine as a career looks like on a day to day. And that's why work experience is really important because I talk about the need for both motivation, which is why you want to do it. If you don't have motivation, there's no point in even, day one doesn't start there because if you don't want to be a medic, then, why are we doing it? But the other thing that we think about is insight. And insight is developing an understanding of what a career in medicine really is like. Because a medical career is not easy. It's tough. There's a lot of challenges. There's a lot of really difficult moments to do. And so you need to show both motivation and insight. So work experience does that. Work experience shows your commitment to a medical career, and it provides you with real experiences for your personal statement, applications, and interviews. It's crucial for understanding what medicine will be like as a career and the challenges that you might face in a medical career. So where do you want to get work experience? I would recommend, so care focused roles are really important, but they're kind of more linked to, again, volunteering, which is really important. If we're talking about work experience, I would focus on that hospital and GP based work experience. So actually get time seeing a doctor or shadowing a doctor going about their day to day, because that will show you what a career and a day to day is really like in the career and will give you a good understanding of what to expect when you do that job in 6 years' time or why you want to do that job later on. So I back care focused roles, and I think you should do those. I think you should do some volunteering somewhere to show a good understanding of patient interaction. But I also back the importance of hospital and GP surgeries. Now, in the post-COVID era, so again, to make me sound really old, when I was applying to medical school, um, volunteer work experience was a lot easier to come by. There were a lot more opportunities to get work experience, especially in clinical settings, because hospitals weren't just completely overrun, in all honesty. Like there wasn't the doctors weren't being forced to do um, a million jobs. Also, the big thing that's changed over the last 6 years is the number of medical students has massively increased. So pretty much every hospital in the UK now will have a huge number of medical students just around the whole time. And so where to find work experience can be quite difficult these days. And there are opportunities in virtual work experience options. Observe GP, the NHS have online resources. Brighton and Sussex Medical School have a really good virtual work experience, which I do recommend to all of my students. And I think that really does help. But trying to get in-person work experience, while difficult, is actually invaluable. It's an invaluable couple of days. I mean, I don't think there were moments when I was doing my application that made me more but motivated than to choose this career than moments that I spent in theatre with an anaesthetist or seeing a surgery happen in front of me where I sat there and I went, this is what I kind of want to do. And while my passions have changed, and while I might not want to necessarily be a surgeon anymore, those opportunities are still completely invaluable in why I want to do medicine. So actually seeing medical interactions, actually seeing consultations, there isn't an experience quite like that. And I do think that those are invaluable kind of experiences that you can have. Leveraging your network is quite a good thing to do. So personal contacts. A lot of my work experience I got through school careers advisors, um, but friends and family who've also done placements. If you don't have that, obviously it's tough. But often a lot of the NHS trusts will have links to forms where you can apply for work experience. More than that, though, many of the medical schools in the UK will have insight weeks and insight opportunities. So if you guys are in Scotland, one of the best examples is Medic Insight. So there's a group that operate at the medical schools in Scotland, and they run like week programs and day programs. In part of that, um, one of the days might be going into a hospital, going into a GP surgery to have some insight into what it's like. So look at the medical schools and look at how they might have programs that are like insight into medicine weeks or access into medicine days where you can go along and you might even hear talks from doctors. You might not see anything, but those are good ways to show insight. You might get a better understanding of what's going on. But yeah, so to try and do your research as much as possible. Remember to email, walk into GP surgeries politely. Remember, just send some follow-up emails, try and get a good understanding of what is going on and how and what and why they might, most GP practices may not take students on, but some may, and you need to think about which ones, try as much as you can. I would the best one of the best pieces of advice I was given is have a brief copy of a CV. So if you're sending an email, attach a copy of your CV, which might show other things that you've done to show interest in medicine, so that at least GPs know that you're serious about applying to medical school. You've got a good understanding of what medical school, what you need to do to get into medical school, so that when they're looking at your CV, they might be more inclined to give you a bit of work experience on the side. But remember, opportunities for work experience do fill up fast. So start early. Apply at least 6 months in advance, I think, normally. Try and be as proactive as possible. Tailor your approach to the company and to the group that you're the GP that you're looking at. And then related sectors, if you can't get anything clinical and try and reflect as much. The big thing is reflection. So work experience without reflection is pointless. So reflect on what you've seen. If you get the privilege of going into hospital or going into a GP practice, even for a day, there's so much you can gain from that and reflect on that well. I would normally write in like after my work experiences, as soon as I got home, what I used to do was I had a Word document and I would put in maybe three things I'd seen that day and what I learned from each of those experiences and what each of those experiences kind of gave me. And that gave me really good reflection when I was talking about those things at interview. Right. Pass back to Emma.
Hi everyone, thanks so much for that, Hamza. We are going to keep going with a day in the life of the doctor coming shortly as well. For that, but I just wanted to give everyone a little bit of an overview on what we here at Medic Mind can support with. As Hamza's just spoken a lot about work experience and where you can get it and how you can get it. I just want to make you aware of what we provide as well. So here at Medic Mind, we provide our medicine summer career camps. These are for ages 15 to 18. They're all based in central London. We have a 1, 2, or 3 week option, and they are available in over 20 careers, but they're also available in medicine and dentistry and veterinary medicine as well. And so during all of these, if we can go to the next slide, please. During all of these, there are so many things that we provide. You can be a residential student, you can be a student who just comes in for the day as well. But one of the main things we do is unlike some work experience, we do provide sort of the real hands-on career experiences. So, an example in medicine is we go to a working hospice, and in this hospice, you get to work with actual workers who are working in there. You get to sit in with patients and understand patient care, and also understand end-of-life care. We also do things like surgery simulations. We go to one of the big London teaching hospitals, and we do a lot of understanding CPR and rescue and everything like that. So yeah, one of the major things is the real hands-on experiences. We also do lots of industry visits and excursions. So again, in terms of medicines, most of this happens in a London teaching hospital. You get to go in, you get to talk to doctors. You're trained how you would be trained at university, and it gives you a little bit of an insight to it prior to going into university as well. Another big highlight is the networking that you get. So you get to network with doctors who are doing these things right now. So you get much more of an understanding of what your medical career could look like, what medical school could look like, and everything moving forward. And it also gives you a chance to build your own network. So as Hamza was just saying about building a network, obviously that can be really important. So it gives you an opportunity to do that, and we provide all of the contact details at the end to make sure that you've got people to talk to. And then lastly, you also get the top tier admissions coaching. So we do a full MMI station day, we do a full UCAT intensive day, and in all of this, you get to speak to loads of experts, loads of people who have been admissions coaches before, but also people who do the admissions now at universities. You're able to talk to them, give them what the answers that you would give, and you get lots of feedback on that as well. And then additionally, we're also a government education partner. We're also Duke of Edinburgh allowed. So if you're doing your Gold Duke of Edinburgh as well, we can also go towards your UCAS and things to talk about in your personal statement. So this is just a bit of a quick overview of exactly what you get in medicine and some of our highlights. So as I was saying before, you can take part in emergency simulations, visit teaching hospitals, visit your hospice, experience a mock MMI circuit and a UCAT intensive workshop as well. So at the end of this webinar, there will be a QR code on the screen where you can find out a little bit more about this that we offer. There will also be an email sent. I know that a couple of people in the chat have already asked about a recording. There will be an email sent after this that will give you the recording and the slides. So you're going to be able to look after over all of this again as well. And there was just one more thing I wanted to tell you about it as well, which was just an example of the types of people that you're going to be learning from. So Dr. Shireen is one of our experts that you learn from, but we have about 5 to 10 experts who you would learn from across the week. If you decided to come for 2 or 3 weeks, we do different intensives on each of the weeks. And as I mentioned, if you're a residential student, you can also come. If you're an international student, sorry, you can also come and stay with us residentially, and you stay in the UCL halls in London. So you get a real understanding of that sort of London university experience as well. But yeah, as I said, everything will be sent in an email afterwards. I just wanted to give you a quick understanding of the types of support that we can offer here to help you with your medical school applications, and how you might be able to move forward as well. So, Hamza, I'll pass back to you. Thank you so much.
Right. So next we're going to talk about the day in the life of a doctor. What can you expect kind of on a normal day as a doctor? So the kind of morning is pretty normal. It's pretty standard across whether you're a medical ward or you're a surgical ward. You would expect to kind of come in for about 7:30, 8 in the morning for a handover. So this is where the night team, who the night team, which is usually a registrar, will come and give you an update on what's going on, and will give you the consultant. So if you're a junior doctor who's on the day shift, for example, you will be you'll be with a consultant team. So they'll give the team just an update, what's going on, and what needs to be followed up on. So there might be, Mrs. Smith in bed 3 might be going in for surgery. So there might be blood results that they need to check, or scan reports, or maybe she's musing at a 5, so we might need more monitoring for her. And so things that we need to think about are usually talked about at the handover. After this, normally on a ward, you've either got a consultant-led ward round, you've got junior-led ward round, or in a surgical ward round, you might even just be yourself doing a ward round where you go bed to bed, and you go and talk to the patient, you kind of review all of their notes, you review their updated blood work, and you decide if you need to make any changes to the management plan. So you might say, okay, I've seen this patient's getting better, so we might try and move her onto a different treatment. Um, or we might think this patient might be getting worse, so we're going to need to monitor more closely, and we might up her dose or something like that. Whatever needs to happen. Some of that is usually done by most of those decisions are usually taken by the consultant. And as a junior, you're making sure that you're taking the notes, you're doing the prescribing, and you're kind of monitoring those test results, making sure that everything's ready. Um, and then so you're doing the whole holistic management of a human being. Now this could take, if it's a surgical ward round, you can expect that to be done pretty quickly because your surgeon consultant is going to want to go to theatre pretty soon. But if it's a medical ward round where there's a lot going on and the patient has a complex history, a ward round might take 5 or 6 hours. So it might even take up to 1 or 2 in the afternoon. Some long cardiology ward rounds might take most of the day, just to make sure that you're seeing every patient. So you might be working on the door at that point. Um, but after that, at the end of your ward round, you've created a jobs list. So you've looked at all of your patients and you've made a decision on things that need to be done. So you might need to repeat their bloods, you might need to order some scans, you might need to request certain treatment, you might need to, change something that's going on. And you're making sure that you're part of that multidisciplinary team. Um, and once the consultant leaves, then you then become responsible for those jobs. So that job list that you've created during the ward round, which is a list of things you need to do for every patient, which could be prescribing, inserting cannulas, taking blood, making sure that you are requesting the correct scans, either urgently or non-urgently, making sure that you're requesting correct referral, all of those things. You then have to go out and do them as the junior doctor. The multidisciplinary team, you're not working on this alone. You're liaising with a wide team of people, of a variety of specialties, just to make sure that the patient is getting as holistic of care as possible. So most of your day is about 50-50, really. Half of your day is high-level clinical work, and half of it is coordinating a lot of admin and making sure that the correct paperwork is being filled out, because everything in medicine needs to be documented correctly, because otherwise you risk losing things. Um, and so those are really important things to do. And then at 5 o'clock, about 4:30 actually, everyone goes back to the doctor's office and you do a second handover. So this time you hand over to either the late team or you hand over to the night team, and you're handovering back, and you're saying this is what needs to be chased up, remembering being mindful that at night you're not going to get bloods, you're not going to really get blood test results that easily, you might not get scans done that easily. So you're trying to manage the ship a little bit there, but you're handing back over to your colleagues, and you're making sure that everyone's aware of what needs to be taken forward to ensure good patient care overnight. And so it's kind of a 12-hourly cycle essentially in a hospital where every 12 hours the team changes, and there's 2 handovers during a day. When you end medical school, you basically you initially get something called provisional registration with the GMC, which is where you are a fully qualified and licensed doctor, but you are heavily supervised. So there's certain things you can't do. For example, you can't detain a patient as an FY1. You can detain patients from FY2 and above until you get complete registration. But as of FY1, you are a provisionally licensed doctor. That doesn't stop a lot, though. You still might be carrying the crash bleep for the hospital. You still might be the first person that are called when a patient deteriorates. Here in Scotland, you in England it's actually slightly more protected. So I have colleagues who work down and friends who now work down in England, where they don't tend to do as many nights or weekends on call. I.e. being when you're on call, you're one of a very small team in the entire hospital, so you're managing a huge array of patients. Whereas in Scotland, you could still be expected to do nights and weekends on call on a regular basis on most wards. And so you might be called when a patient deteriorates. You also do carry the bleep. So the bleep is a kind of pager that is usually so if other specialties want to refer their patient to you, you'll carry the bleep. And then you'll be asked to go and do an assessment of the patient to decide if you think that they're appropriate for you to take on. So, for example, if you're the general surgical FY1 and you've got an A&E patient who comes in and has got really bad abdominal pain, that might be a gen surg issue. They've got a CT abdomen. You think they've got appendicitis, so they're going to bleep the general surgical registrar or FY or whoever the most junior doctor is on the general surgical team. So during the day, it might be you as the FY1, and you'll then be asked to go and do an assessment of the patient to determine whether they should be moved up to the general surgical ward, for example, and then for surgical management. Um, and that kind of is the general procedure to make sure that the hospital flows correctly. One of the common things in medicine is imposter syndrome. So imposter syndrome exists at every point of your medical career. Um, you'll feel it when you go from A levels to your first year of medical school. You'll be terrified. You'll be like, I don't really know what's going on. You'll feel it again when you go from probably in your third year of medical school, when you go from a very comforting lecture-based environment to being on the wards, and you're suddenly kind of stuck on a really significant ward, and you're kind of expected to help out and do things, and you'll probably feel it again when you go from final year medical student to first year doctor, and they'll expect you to actually, have an active responsibility in managing a patient. So imposter syndrome is normal. It's very common in medicine, and pretty much every doctor feels and experiences that at some point. So I don't think that's something that you want to worry about too much. Gonna see if the tech doesn't seem to be working again. Nope, I think we've gone too far. Okay. Um, Again, so out of hours work is pretty common in medicine, as I was mentioning. So on calls and night shifts, less common in England now, because of how protected FI1s are. But there are out of hours and night shifts that are part of the job. And the European Time Directive basically means that you should only work a maximum of 40 hours a week. Um, but a 40-hour rota is normally 48 to 50 hours with on-call shifts and weekends altogether factored in. Usually that means your job might be what we call double banded or triple banded in medicine, which means you get paid time and a half to do a rota that goes above the European Time Directive, um, or if you have really unsociable working conditions. So you might get a double banded or even a triple banded job. So some tertiary centers where you're doing basically 1 in 3 weekends, where you're working one weekend every 3 weekends, you might be on a triple banded rota where you're being paid times two salary. to do that, and that's completely normal. Night shift are relatively common where you're covering more than one ward with a very skeleton staff, so there aren't that many nurses on, and you are probably one of the most senior doctors on that ward, which is kind of scary when you think about it, because your consultant isn't even in the hospital. Where if I have an emergency during the day, your consultant is probably in the hospital, maybe on a different floor, maybe going to do something else, maybe in a clinic, but you can always call them and be like, I need some help with this. And they're maybe 5, 10 minutes away at worst. Um, on a night shift, you might have your consultant at home, maybe 30, 40 minutes by car. So you're going to have to manage the issue until your consultant gets back onto the ward, back on in person. Um, but yeah, it's important to remember to maximize your time outside of work. A good doctor is not a doctor who doesn't take care of themselves. A good doctor is one that does take care of themselves, and being confident to take the time for yourself is really important in medicine. Um, the reality, though, of medicine is the bottleneck now. So one of the big issues in medical school at the moment, which is slowly changing with the new prioritization bill, but essentially you do your 2 years of foundation training and then you're kind of stuck. You have to reapply for specialty training, and specialty training is becoming increasingly more and more competitive. Um, and we've got a bit of a bottleneck at the moment where there's lots and lots of applicants and lots of people who want a job, very few jobs at the other end. And so actually we've bottlenecked the number of people who are getting into specialty training. So a growing trend in the sense that it's actually almost now half to 60% of doctors will take an F3 or an F4 or even an F5 year, where they take a couple of gap years to decide what they really want to do, and make a commitment. With the increasing amount of burnout in doctors post F2 as well, often if you guys are 8, 16, you've probably done your probably you probably go from year 10 to, so if you're probably like 15 at year 10, you probably don't get a year where you have a real break from working until you're about 25 for most people, in terms of you're going to do your GCSEs, then you do your AS, which is littered with doing your work experience and volunteering, UCAT. So, and then you do your A levels, and then you do 6 years of medical school, and every year you have to pass an exam that year, and you do 2 years of foundation training, where you have to pass milestones to get through that. So you've probably in about a decade probably not had a year where you've not sat an exam. And so often a lot of doctors do choose to take a break after F2, where they want to kind of take a year to go traveling, do a bit of research, find something else to do during that year. And that's kind of quite normal. But why do people do medicine? Because I feel like that was a bit of a negative side about the nature of medicine, and the bottlenecking. The human connection, we are with patients usually at their most vulnerable moments, which is kind of incredible. Not many people can say that they've been at both a patient's death and the birth of a new life. And most medical students and doctors would be able to say that, like that you've both seen birth of new life and someone dying, which is pretty kind of nuts to say. You are with patients at their most vulnerable moments. No 2 days are the same. You become a detective solving puzzles that are going on in people's brains. You're doing tests, but those tests are kind of clues that give you a little bit more information, which is so cool. And you're thinking about what this could be, and there are millions of diagnoses, some of them more rare than the others. And one day you wake up and you see something really rare, and you're thinking, why has this happened? What is the contributing factors behind this? Um, and also the team, unlike most jobs, I've got friends who work in pretty much every industry, from school, and often they talk about almost being in a competitive spirit with their colleagues a little bit, where they're kind of working against them to get promotions and move further up the training ladder. Whereas in medicine, the only limiting factor is the system. It's not actually the other people on the team. And so you kind of then develop a bit of a team camaraderie and a team bond, which is quite cool and kind of incredible to have. So medicine is a rewarding job. Um, yeah. So four key takeaways that we talked about. We've talked about what the UCAT is, MMIs. We've talked about work experience, why is it important. We've talked about a day in the life of a doctor, and what hopefully you guys will experience in about 7 years' time. Hopefully, what I'll get to in about 6 months' time. And then what Medicline can offer you to help you kind of reach that goal of getting into medical school, hopefully soon.
Thank you so much, Hamza. That's all been really, really helpful. So I just wanted to give everyone a little bit of a time to potentially fill out our feedback form. So this feedback form is super simple. It's about 4 questions. It should only take you about a minute. And from this, we will be choosing a winner to do a one-to-one career coaching session. Obviously, as I'm aware that the majority of students on here will be looking for medicine, this will likely be with one of our doctors or UCAT or MMI experts, depending on what you would like. But yeah, it really does take a couple of seconds to fill out. So I'd be really grateful if you did. And I think just for the last 10 minutes as well, we have had some questions come in on the chat. So Hamza, if you're good to go through those, or I'm happy to talk through them as well, to you.
Yeah.
But I don't really look through
Would
the
you be able
chat.
to read them out? I don't know which ones the questions are, but
Yeah, 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 absolutely.
put those in the chat.
So So I think some of this has been answered throughout, but I'm just going to ask them, and then if you feel like they've been answered, that's fine. So we've got one here, which is as a year 12, which is 2027 entry, what is the important things to be doing now from now to summer 2026 and then to summer 2027 to stand out as a student?
Good.
Or what things to prioritize? UCAT, personal statements, CV, grades. So sort of asking about prioritization and what's really important to be doing in this moment.
Good question. So the big things is get three A's at your year 12 mocks. Right now, your mocks are probably in May, April, May, June, probably. Get your three A's in your A-level mocks. If you don't get that, you're kind of it's kind of DOA almost. Like there won't be many medical schools that will accept you anyway. Then I would say right now, get your work experience sorted. Aim for work experience over your Easter holidays or your May half term. You don't want to be leaving that till the summer. It's really difficult to get work experience in the summer because consultants go on holiday as well. Lots of consultants have families, so they tend to leave. So the summer is almost a bit of a ghost town for it's not a ghost town for hospitals, but in a way, the consultants who would be willing to take people on are often away for bits of the summer. So don't wait till the summer. And also, your summer's busy. You could be revising for the UCAT. So I know it seems like there's a lot to do, but right now, what my aims would be is for you to find weekly volunteering that you want to be doing every week, whatever that may be, food bank, charity shop, working at a care home, uh, maybe even helping out with something in the community. Try and do something where you're in a person-facing role every week. Get those three A's in your mocks. Get some work experience organized for your Easter holidays. That's until summer. Then in June, start revising for your UCAT. Your UCAT's going to be the priority. Book that in for September before you go back to school. Then you're going to have a year of A levels, and those are pretty tough in themselves. They'll take your full time. So don't. So those are the things you want to be thinking about right now. And then interviews are probably later towards the other part of um early next year, essentially. So interviews a little bit later on. But that's kind of my approach to it. Right now is getting through some volunteering, getting some work experience organized, and getting yourself starting to look at the UCAT a little bit, but making sure those three A's are done.
Great, cool. So the next one we've got is virtual work experience considered the same as in-person work experience if you reflect on it well?
Now it is, yeah. I think it's more difficult to see things virtually, but then that's me. Maybe personally, a lot of people do like the word virtual work experience options. If you can't get in-person work experience, that is okay. The system has changed quite a lot, and it is very difficult to get in-person work experience now. But yeah, so on an official level, it is considered the same. Yeah.
Absolutely. And then we've got a question here on how to prepare for MMIs. So asking about whether they should memorize set answers or keywords that correlate.
Memorizing answers doesn't help you for an MMI. Practicing MMIs is the best way to to get ready for an MMI. So you need to see a variety of questions. Remember, the big thing is you're answering the questions that you are given, not the question you want to be given. And that's what one of the things I notice about students who memorize answers, quote unquote, is that they end up just answering a series of 10 questions that they've memorized, and then they try to link that to every question. But then you as the interviewer, going, that's not what I'm looking for this question. That's not what I'm trying to ask you. So yes, so no memorization, practice. But again, something that you'll probably end up naturally getting more practice with as you get closer to those times. And there are loads of good MMI circuits that MedicMind run, which I recommend going to because those are really good for getting that practice in.
Yeah, absolutely. We've got some which are a little bit adjacent to this, more about getting experience your personal statement. So we've had a question here on what are some ways I can get a leadership role outside of school, since my school leadership roles have all been taken, and I know you need it for your personal statement. Um, I'm happy to jump in a little bit on this
Yeah.
one and say there are so many other places that you can get leadership roles. So as we've discussed, some of the volunteering and things like that you can if you can volunteer in a charity shop or even I did a lot of volunteering at brownies and guides and places like that. You can gain leadership roles which they can be adjacent. They don't have to be exactly within medicine. They can just be being proactive out in your community and things like that. So I think there are plenty of places where you can reach out to, and also a lot of the times, depending on your age, obviously it is more going to be the sort of volunteering side of things. And there are so many websites that you can look at volunteering. If you literally just type into Google volunteering roles with your age, there'll be lots of places that you can go. The other thing is I know you've said obviously a lot of your school's leadership roles have been taken, but there's also sometimes other ways that you can do leadership roles within schools. So whether that's doing helping out after school care or whether that's helping out in the school office or anything like that as well. There's quite a there are lots of different places you can get. So I think a lot of it is thinking a little bit outside the box with it as well. But volunteering I would really recommend as somewhere that you can look for those, or and that can also be helping out at local dance class or something like that. There are loads of places that you can get that stuff as well. So I don't know, Hamza, if there was anything else you wanted to add on that, but that's just something that
No, I think that's completely right. Yeah, lots of adjacent things to medicine that probably would count really well for leadership. Even offering to run maybe like a tutoring class for some year sevens or year eights in a subject area that you're interested in. So if you're like really if you're good with your biology, offering to run like a lunchtime science revision catch up for some of the younger years. That counts as leadership. That's good communication. That's all of those things that they would be looking for. So that's kind of it. Yeah.
Yeah, and I think so much of personal statements when you're writing those, like you've got to think about the transferable skills as well. So
Yeah.
obviously making it significant to medicine is obviously important, but if you can show those transferable skills, that's also a really important part of it as well. So yeah, so we just had another question here. Would a casualty care course with the Coast Guard aid my application? And does being on call with the Coast Guard for a year count as work experience, volunteering, or both? I would say both.
That that sounds both. Yeah. To me,
Yeah.
that sounds like a really good thing to do. Yeah, a casualty care course would definitely aid your application. Would definitely be a unique thing that they don't really see a lot in an interview. And if you can reflect on it well, that could be really successful. And then being on call with the Coast Guard, that is both the work experience and volunteering, because the Coast Guard does a lot of kind of first aid and paramedic style management on the scene, which would be really good. So yes, it was both.
Absolutely. And then we've just got a question here from, I think, one of our younger members. So it's if you're doing your GCSEs, when should you start preparing for all of the medical school applications? And what subjects did you do for your A levels?
So, when should I start prepping for my applications? I would start next year when you do AS.
Mhm.
Right now, you've got bigger fish to fry, which are probably your GCSEs. and making sure you try and get your best grades as possible. What did I do for my A levels? I did biology, chemistry, maths, and philosophy at A level. So I did four. You don't need to do four. I did four because I was told that you needed maths. You don't need maths, which I think is really important for you to know. And I was interested in philosophy. It was the subject that I wanted to do. So I chose to do four. But you do not need to do to make this clear, you do not need to do four A levels to apply to medical school, and it does not aid your application more. Um, if you do four A levels, choose in terms of A levels you need to do chemistry. Biology is heavily preferred, um, but it's not necessary. You need to do at least two sciences. So if you're not doing biology, you would have to do one of physics or maths. So up to you. And then you do any third subject. So normally I would recommend chemistry, biology, and then a third subject you're interested in, or a subject that you think you would do very well. A subject you think you would do very well in. That's my advice.
Perfect. So this is the last question I got for the moment. We do have a few more minutes, so if there is any other questions just after this, we probably have time for a couple more. But this is the last one I've got for now. If a medical school application doesn't go as planned, what approaches would you advise students to take in order to recover and strengthen the plan B for future applications?
So I didn't identify what it was that kind of cut you out that time, right? So was it an interview thing? Was it that your UCAT wasn't strong enough? Because there's lots of reasons why you could fall over at a particular hurdle. If it's an interview thing, then maybe more practice for your interviews, making sure you get more of those, making sure you're starting a little bit earlier in preparation for your interviews, looking into why you're kind of considering the what was your explanation? What about your answers was wrong? Sometimes you can email medical schools and they might give you some feedback if you're going for an interview to tell you what about your interview wasn't as successful. Sometimes not all medical schools will accept that, but some will. If it's a UCAT thing, start earlier. UCAT, the UCAT is not, then remember it's just all about practicing for the UCAT. And then in terms of taking a gap year, um, which you might end up having to do, and that's okay. In your gap year, try and do some volunteering, try and do a bit more work experience, maybe get a job in a medically adjacent area if you can. So it doesn't have to necessarily be in a hospital, but maybe try and get a job maybe in a pharmacy, maybe in a shop, maybe something that is customer facing. So you actually get an experience of talking to people, but also use that as a bit of a time to get a bit of a break in. Um, you're going to be on the go for many years after that. So also use it as a bit of a time to develop yourself and travel a little bit. And a gap year isn't the worst thing in the world. Um, many people who are in my position now wish they had taken a gap year before they came to medical school. So it's not necessarily the worst thing in the world to take a gap year.
Fantastic. Okay. I've got the three last questions and they should be quick fire.
Yeah,
So
but
so we've got do dental practices, physiotherapy clinics, work experience in another country also count as clinical work experience?
if they're patient facing, their clinical work experience, yeah.
Perfect. And then we've also got someone who I think was probably their third A level picked criminology, saying, are they going to be a bit less considered when applying?
Yep. Because it's math, it's biology, chemistry, and anything. So criminology will not be considered less.
Perfect. And then the last one, it might be a little bit longer, but this will be our last question. What do you do if you don't get a good UCAT score? Can you redo
Um,
it?
you can redo it. You can redo it once a year. So you if you don't get a good UCAT score, i.e. you get a UCAT score that doesn't give you an offer, um, which is difficult because if you apply strategically, there are lots of medical schools that don't really look at the UCAT at all. But if you don't really get a good UCAT score at all, and you're thinking, I want to go to a particular university, but you can redo it once per cycle. So you would have to then take a gap year or a redo. And you would, and my advice for that would be to, well, identify what you struggled with, come back earlier, maybe get some tuition, maybe get some help, and get someone to talk you through the areas you're struggling with. Start practicing earlier, do more mocks, really train for it differently. Um, if you're struggling with the UCAT, but yes, it's one per cycle.
Perfect. Okay, well, I think that's everything today. So thank you
No
so
worries.
much, everyone, for attending. Thank you so much, Hamza, for coming on and talking to us all today. As I said, we will be sending the slides and the presentation to everyone in an email that should be coming to you tomorrow. And if you don't receive that, please feel free to reach out to us on info@medicmind.co.uk. And yeah, thank you so much, everyone. Best of luck in your future applications. And we hope to hear from you soon. Thanks all.